This is Dr. Kavanagh by Associates of South Texas. I'm going to give you a short video tutorial on power washing of cortical remnants. I find this a useful technique after removing the bulk of the cortex with irrigation aspiration, as shown here, to use a 27 gauge long cannula to wash out those stringy bits of cortex that are left from the periphery inward, as you can see here. So we wash it off with a 27 gauge cannula with BSS loaded on a 3cc syringe. We can also power wash off the posterior capsule centrally without any risk of damaging the posterior capsule. In the last 2,000 cases I've done, you can see we're filling the bag with Helon here, and it's an extremely clear central capsule. That's the goal of removing the cortical material, is to have a nice clear capsule day one centrally. This will give the patient better chances of uncorrected good visual acuity. Again, you can see a second case here. We wash off the posterior capsule with BSS on a 27 gauge cannula. I find it useful to use a longer cannula and to enter the anterior chamber from two directions, going temporally and nasally second, and then also to wash the central posterior capsule off with BSS. You can see here we're going to inject in an intraocular lens implant. I'm just going to show you how, if there are any strands of cortex left, you can aspirate them after you put the lens in, or just bring the cortex forward to drape over the posterior chamber lens, and then they will drape backwards over the capsule, as you'll be able to see post-operatively. Again, we remove the cortex on a third case, and you'll see a quick wash of the posterior capsule using BSS, and see we're removing these fine remnants that are difficult to get with your normal irrigation aspiration handpiece, be it steel or silicone tipped. You have to go to a cap vac setting that can sometimes slow your case down, and also can be dangerous as there's a chance of rupturing the posterior capsule, which in my hands I found to be much lower using a BSS on a 27 gauge cannula. Here's a case. You can see that we're polishing the posterior capsule with BSS, and there's a large area of attached cortex inferiorly in this case, and you can see that we're going to drape that cortex back over the anterior capsule leaf using Helon. This is a case where we have a small PSC plaque. Instead of polishing the capsule with the INA handpiece, we can use BSS on a 27 gauge cannula after removing the bulk of the cortex with the irrigation aspiration handpiece, and just see how this washes off. You can also wash off any peripheral cortex that you see attached to the posterior capsule. And this I find to be a very quick and I think elegant technique to remove that remaining area of cortex. Here's a piece of nucleus we're removing with the irrigation aspiration handpiece. It happens to be a silicone tipped one, and you can see that we have a little cortical remnants here inferiorly and on the posterior capsule, and you can see how easily we just wash them off with the BSS cannula on a 3cc syringe. Now we're ready to inject Helon and implant the intraocular lens. Day one, these patients, again, I see have very clear central posterior capsules that give them very good uncorrected visual acuity. Here's a case with a smallish pupil or smaller pupil, and you can see that we can again wash out the capsular or cortical remnants here with BSS on a 27 gauge cannula. See how those capsular remnants drape over the anterior capsule and are not adherent anymore to the posterior capsule, and therefore will reduce the amount of posterior posterior capsular opacification you'll see later on. You can also wash cortex from the angle, as seen here. Once we complete irrigation aspiration, remove a nuclear remnant using the irrigated aspiration handpiece. If we inject in BSS on a 27 gauge cannula, you can see we can go into the cortical fornix or the capsular fornices and see that we can wash out large amounts of cortical material that are difficult to see under the mask of the iris. And once you free up these cortical remnants, it is easy to implant a normal posterior chamber intraocular lens implant, and you will see that we can remove the cortex after implanting the lens. Again, it's free and much easier to be removed. We are going to use the irrigation aspiration handpiece to remove the cortical remnant nasally here, and once the irrigation aspiration handpiece is in place, it's very easy to remove this remaining cortex that has been freed with the washing with balanced salt solution. Here's another case where we can see we've removed the majority of the cortical material, and we just want to wash off the residual strands of cortex that can lead to early posterior capsule opacification. If we force these into the fornices of the capsule, the square posterior edge of most posterior chamber implants these days will stop posterior capsule opacification at the junction of the posterior square edge of the intraocular lens implant and the capsular fornice. Here you can see a case where we've removed the cortex. Again, there's strandy cortical remnants, and you can see we can wash these off very easily again with balanced salt solution. This maneuver can be difficult with a steel-tipped irrigation aspiration handpiece, and also difficult with a silicone-tipped irrigation aspiration handpiece, although much less risk of capsule rupture using a silicone-tipped handpiece. The central posterior capsule again is seen to be clear, and we can inject in Helon and then inject in a intraocular lens implant. And again, visual acuity on day one can be very good as long as the refractive target has been met. We see here there is, after cortical removal, remnant strands of posterior capsular cortex, and we again remove them with balanced salt solution on a 27 gauge long cannula, and you can see how easily these little strands wash off. I'm going to show you next a case that you'll see about 1 in every 10 cases of a floppy posterior capsule. This is common in patients with zonular laxity or large cataract, where the capsule has been stretched by the cataract or by the loose zonules. You'll see here when we inject balanced salt solution, the capsule blows around and you can see stria on the posterior capsule. It is important in these cases to not overfill the anterior chamber with BSS, but to allow the chamber to collapse to cause the posterior capsule to elevate. This puts the capsule under stress. When you inject the BSS, it's easier to wash off the cortical remnants. And this can be frustrating until you learn to let the chamber collapse and let the posterior capsule elevate. Here we're going to remove the cortical remnants using irrigation aspiration, and we're left with these stringy pieces of capsule, and you can see that we wash them off very easily with the balanced salt solution cannula on a 3 cc syringe. Once they're clear, we can inject in Helon, our viscoelastic, or Provisc, whatever cohesive you choose, and you will see that the area where the lens will be implanted again is very clear centrally, and this is important for those uncorrected day 1 postoperative appearance. Our last case, you can see we remove the remaining cortex. with irrigation aspiration. And again, we're going to use our 27 gauge cannula to wash off the posterior capsule. There's those difficult to get remnants on the posterior capsule, and just underneath the capsule-rhexis junction that we've washed off, leaving a clean capsule. Thank you for your attention. This is Dr. Kavanagh of Eye Associates of South Texas, showing you my method to remove posterior capsule remnants with balanced salt solution on a 27 gauge cannula.